Good morning. I'd like to call the Finance, Ways, and Means Committee to order for March 1st, 2023. I know you feel like you were just here, but we are back again to continue with our budget hearings. Before we get underway today, are there any personal orders or announcements? Seeing none, we have 3 budget hearings scheduled this morning. We're going to begin with the Department of Children's Services. Members, as always, the presentations provided by the department. You can find them on dashboard if you have trouble seeing the screen. And without objection, we will go out of session, and we will ask the commissioner, who's already poised and ready there at the table, to introduce herself and her team and just begin the presentation.
Thank you, Chair Lady Hazelwood and honorable members of the committee. I'd like to introduce my table. Is to the right of me is, and your left, Chief of Staff Andy Varinsky and Assistant Commissioner Mohammed El Casey, in charge of our budget and finance. And behind me, this large group of wonderful folks are deputy commissioners and all of our regional directors in the Office of Child Safety and Child Programs, along with a number of other staff of the Department of Children's Services. They are from all across the state, and we welcome them this morning to Nashville. They are here for some meetings, so we are thrilled for them to be here and part of the budget hearing this morning. As Commissioner of the Department of Children's Services, I appreciate the opportunity to share with you our budget priorities to address several issues that impact the placement of children. These actions are also responsive to the recent audit findings by the Comptroller. Governor Lee has laid out his budget plan outlining more than $190 million in additional resources to provide for the safety and well-being of Tennessee's children. We have taken important first steps in improving our recruitment and the training of new employees. The proposed budget includes funds for better salaries, managed caseloads, and greater collaboration among all our partners. Another priority for us is to improve capacity in our provider network, and Governor Lee's initiative will impact our bed capacity and reduce the time children spend in transition homes awaiting placement. At the Department of Children's Services, our responsibilities are to investigate allegations of child abuse and neglect, to monitor children's health while in custody, to run the state's foster care system, and to oversee kids found delinquent by juvenile courts. The people associated with DCS have the potential for the most positive impact on our services. Our commitment is to give our employees the tools to solve problems, to build a team that does rigorous work, to reward their efforts, and to be an agency they want to serve well. I believe the 2023-2024 budget focuses on our 3 primary goals: to increase the bed capacity in the provider network that will lead to immediately reducing children and youth in transitional homes, to recruit and retain employees and reduce turnover rates by smartly adjusting workloads and improving salaries so we service more Tennessee children, and to replace the current TFAC system with a modern cloud-based case management and payment system that serves department employees, foster families, and the provider network. Slide 1. The most significant investments in the governor's budget are $33 million to increase bed capacity in the Department of Children's Services provider network to reduce the time children and youth wait on placement. This is 48 beds strategically located across the 3 grand divisions for clinical assessments to determine a child or youth's best first or next placement. 118 beds throughout the provider network that are currently unavailable to DCS due to lack of funding or staffing. $39.8 million to increase the rate of payment for providers in the DCS provider network that offer residential and clinical services to children in state custody. There was a $33 million increase in July 2022, but in the 9 years prior, 5 of those years, there was no rate increase at all. The department had fallen so far behind that this year's increase will bring us to even. We are talking to the providers weekly regarding bed availability. $62 million to replace the Tennessee Family and Child Tracking System, TFACS, the DCS case management and payment system. $11 million to private provider case management to alleviate the burden on case managers while the department hires to full staffing. A RFP will be issued in July to qualified private providers across the state to provide case management for the Child Programs Division, foster care and adoption support. We will target 5 regions: Davidson, Mid-Cumberland, Northeast, Knox, and Smoky. These regions have the highest caseload averages. $15.9 million to align DCS case manager salaries with market salaries regionally and in the private sector. On February 16, 2023, DCS utilized departmental equity and raised the case manager salary ranges significantly. The starting salary for Case Manager 1 is now $50,600. Case Manager 2s are $54,400. Case Manager 3s are $61,000. Case Manager 4s are $68,400. And team coordinators now make $76,600. No case manager is within $10,000 of the top of the range, and all case managers received at least a 3% raise if they were at the midpoint or above, thus relieving any compression within the range. There's $5 million for juvenile justice youth intervention partnerships to increase collaboration with community-based partners to support youth stepping down from juvenile facilities. Next slide, please. $1 million to expand safe baby courts. SBCs reduced the average time to permanency for custodial cases by 26.2% in calendar year 20 and 23.7% in calendar year 21 compared to traditional foster care cases. Not only is permanency being achieved faster in SBC cases, but it is also permanency that is stopping the cycle of repeat maltreatment. The funding for the expansion of safe baby courts will allow for the expansion into regions where this model is not available and will allow for additional safe baby courts in areas with increased cases of drug-exposed infants, families with substance abuse issues, and increased numbers of custodial episodes. Funding will allow for 5 rural courts to be funded at $125,000 and 2 urban courts at $200,000. Safe Baby Court sites serve up to 20 families involved in juvenile court proceedings with intensive intervention services and court oversight. $7.3 million cost of living rate increase to increase support to foster families and incentivize foster care and adoption sibling groups and teens. Next slide. The next slide illustrates the supplemental budget we requested in February. This slide reveals our custody trends. We currently have 8,356 dependent and neglect children and youth in the custody of the Department of Children's Services. Except for 2020, the numbers are holding steady. Over time, I believe that with the relative caregiver program and focus on adoption, we should be able to bring the in-custody numbers down. Since my swearing in on September 1st, the juvenile justice numbers have fluctuated between 600 and 620. Next slide. The next slide provides information on DCS's turnover rate, a topic that has been much in the news and is a focus of my administration. On the left graph, you will see that the all case manager turnover rate peaked in FY 2022 at 28.8% and is declining at 23.4% in FY 2023. We are taking a very aggressive approach to hiring and retention, and I wanted to share some of our efforts with you this morning. We have restructured the pre-service training to an in-person and lengthened it from 9 weeks to 24 weeks. Taking a page from other states with very low turnover rates, we have expanded simulation labs and mock court weeks along with a week in Nashville to meet with DCS leadership staff. We have changed the DCS policy to cap caseloads for first-year case managers at 10 and increased their start salary to $50,600, beginning on February 16, 2023. Since announcing the new start salary, we have received over 500 new applications. To retain our veteran case managers and address compression, we raised the entire case manager series and raised the ranges so that no case manager is within $10,000 of the top of the range. We have limited the number of hours worked in a day and reduced the reimbursement paperwork, and executive leadership are meeting in person with frontline staff to hear their concerns and try to meet their needs. Next slide. 88.2% of all funds spent at DCS go to serve children and families. Next slide. In the proposed 2024 budget, the breakdown looks a little different because of the request to replace the TFAC system. Although the system will greatly enhance the services, deliverables to children, foster families, and the provider network, as well as relieve burdens on case managers' jobs exponentially. Next slide. This last slide illustrates funding sources for the department. The other listed is TennCare, and TennCare is broken down to 65% federal funds and 35% state funds. The governor's action in identifying and prioritizing additional funds for DCS, along with support from the General Assembly, will put us on the right path for improved outcomes. Our focus is on ensuring that everything we do has a positive impact in a child's life. I look forward to your questions.
Thank you, Commissioner. And we appreciate both the brevity of your presentation, recognizing the depth of the work that you all do in the state. There's a lot of information there, and then a lot of detail that I'm sure there may be questions about. The first person on my list, I have Representative Gant.
Thank you, Chairman. Good morning. Commissioner, thank you for being here and your team. And I say you got quite the entourage behind you. I've never quite seen the room so off-sided with so many people. So thank you for being here. Appreciate you being here this morning. Last year, DCS was authorized to implement an extension of the foster care program to provide services to certain young adults between 18 and 21 and requires payments to relative caregivers to be equal to 50% of the foster care rate starting January of this year. Can the department provide an update on the rollout of these initiatives, and is this payment structure enough to incentivize an increase in the number of relative caregivers?
We have begun payments, yes. We were given that 6-month window in order to begin the technological process to TFACs. And those first payments have started to go out. Mohammed may have more information on that.
Mohammed Al-Kaisi, Assistant Commissioner of Finance and Budget. As the Commissioner stated correctly, that we started the first payment for January service dates. That happens in February 15th because we normally pay at the end of the month. So the first group of people received their 50% of the foster care rates on February 15th. The first checks left out to the relative caregivers.
Okay. Thank you, Madam Chair.
Just to follow up on that, since the money was budgeted, I believe, for the entire year, the payments only began in January. So what will happen with the additional funding that was not utilized for the first 6 months of the fiscal year?
So the budget in 23 was budgeted only for 6 months. Originally was for 1 year, but it was adjusted at the end to just reflect only 6 months. So we didn't have the original budget was 32 million, but we had actually in the budget.
And do you foresee that number one will cover the requirement, the need, or will there be a need for additional funding, or will that be an excess of funding? Or do you have any idea at this point?
At this point, I don't have a clear picture because this is a new program, but in 24, we did not request any additional funding, anticipating that the fund that we have already in the budget will be sufficient.
Which will be the 32 for
Which
the
will be
entire
the
year.
$32 million.
Thank you.
Appreciate it.
Chairman Boyd.
Thank you, Madam Chair Lady. Commissioners, great to see you today. And just had a question. In the budget, you had $11.4 million for contracted case managers to sort of take the caseload off of existing staff. And when we look at budget numbers, we see one time and we see recurring. And so could you clarify that it's for a temporary fix, but it appears to be recurring? So do you anticipate this being recurring indefinitely, or is it temporary? And if it is temporary, how long?
Thank you, Representative Boyd. We asked for 2 years reoccurring, and we did that because we've got 410 to 15 case managers at this point. When I started, we had about 620 openings. We're down to about 410 case manager openings right now. We can't do that in a year. And so I asked for 2 years reoccurring on privatized case management because I think it'll take me that long to hire that number of case managers. And I feel like we need to relieve the burden on case managers while we hire that number of staff. So it is 2 years reoccurring.
Representative Chairman Boyd.
Thank you, Chair Lady. And so what is the salary of these temporary workers and who's liable if they make some sort of mistake?
So the salary that we have set aside for and what we budgeted is $125,000, and that seems really off kilter compared to what we pay ours. But the reason we budgeted that is because when we pay that to the private provider, that also includes their supervision and all of the supports that go around that case manager. So that would be administrative support, supervisory support, and again, all of the other. When we budget a case manager, it's not just $50,600. We budget a number of other administrative costs around that case manager salary. And so we budgeted that for supervisor and administrative costs as well.
Chairman Boyd.
And as far as the liability if they make a mistake, is that going to be DCS or does that stop with that company?
So we're going to be training those personnel. They will be trained in pre-service by the department. This works well in other states. Florida is 100% privatized. Missouri is 100% privatized. We will be looking at their policies and their procedures, and we will be operating in a very similar manner to what they do.
Chairman Williams.
Thank you, Commissioner. Thank you, Chair Lady. Just a follow-up to Chairman Boyd's question. So, of course, being a finance are trigger words, right? And what I heard was 2 years of reoccurring funding. So I guess to better explain that, what we're doing for case managers is we're taking existing dollars, we're recurring dollars, and we're shifting them somewhere else. Could you tell me better as to how we're funding something with recurring dollars and then it ends after 2 years?
I'm not sure I fully understand the question. We're asking for 2 years of reoccurring dollars in order to put out an RFP for privatized case management.
Okay.
And then the grants would end in 2 years.
Yes. So
The
Chair Lady.
contract would end.
Yes. I'm not trying to make anybody stumble here. I just don't. Typically what happens is when we have a short deadline on the utilization of funds and anything less than 3 years, we consider that non-recurring revenue. And so we can spend that money in that fashion. Usually when we spend recurring revenue, it is in perpetuity until we make some kind of legislative change. And so the question is if we're shifting money to pay for this reoccurring, what happens to the money 2 years from now? Is that money coming back to the department because it still exists because it's using reoccurring dollars to fund that? Budget Director, you may know better.
Yes.
About
When we budgeted originally, it was, as a matter of fact, yes, it was budgeted as recurring because we had no, idea how long that the funding will last. But of course, the commission, after we did more analysis and we figured out that it is very possible that funding would not continue if we get all the rate increases for the salaries for case managers, and we've seen that there will be staff applying for these positions, that funding will have to end, and we will reduce our budget by that exact amount.
Sorry, I won't beat a dead horse there, Chair Lady, but it is an issue that we need to continue to further look at as it relates to how we're spending these dollars. But I'll move on to case managers. Just a quick question. $15.9 million we spent 22-23. Was a shift to try to spend some of that money more quickly. The question, a quick question would be, have you seen any benefit so far? Is it too early as it relates to case managers and this reutilization of money so far?
Are you talking about the raises that we just implemented?
Yes, for the salary market adjustment.
So we implemented those in February of 2 weeks ago.
Okay.
So we've seen 500 new applicants in 2 weeks, which is extraordinary.
Mhm.
Our retention rate right now is 98%, which again is extraordinary. So things are looking up.
Yeah, I think that's important for this this body as it relates to funding, and also those people in our communities who had concern about what we're doing. I think we've gone from a period of time where people were running from the sinking ship to a place where people are excited about going to work here. I think the difference is markedly the pay. Chair Lady, I have one more question, if that's okay. TFAX, $69.3 million for a new system. Obviously, we can have all the resources in the world, but if we don't manage information correctly, then we have as much trouble as we can. Tell me about that process, where you are in the process, how long you think it would take for us to get this implemented. I think one of the biggest challenges we have sometimes is we give these one-time dollars to do these kinds of things, and 2 years later, we're finding out we just got them started. And I think this is something we really want to see done rather quickly.
Yes, sir. We are starting the pre-procurement process right now. Based on the timeline and the need to transition TFAX, we're looking at a vendor-managed solution. That is what our expectation is right now. The likely approach is a managed and ready-made suite solution tailored to our needs. However, that'll ultimately be determined during the pre-procurement process. We're looking at a vendor that will be chosen sometime probably by March of 2024, and the expected completion date will be June of 2026.
Okay, well, longer than I'd hoped, but I get it. I guess one of the things you mentioned earlier too, that some other states, privatize this work, and we're going to do that for a short period of time, helping people with case management. I guess my question would be, during this pre-procurement process and procurement process, is this TFAX platform available to be used outside of state government, or is it only for utilization of state government employees?
It's if a background process is completed, it is available to be used by some outside employees. It is used by outside employees.
Okay, thank you.
Private providers do use it.
Well, I have a couple of questions to go back to that dead horse and to give it another lick or two. I'm trying to understand. We have these dollars that are recurring for 2 years for these outside case managers, but that is to help as you go through the hiring process to add them. So these positions are already covered in the budget. You have 400 positions, but they're budgeted, correct?
Correct.
You are going to be bringing on some of those positions on a gradual basis. In the meantime, you have these outside private caseworkers. So I guess my question is, could those dollars not have been shifted from the vacant positions to cover the outside case management? I'm just trying to determine if seems to me somehow we're double dipping here. So help me understand why we need additional monies rather than just having shifted monies from the vacant position pool to hire these new case managers. And then as the hirees come on board, the monies would come back from the original budget pool versus this outside. I'm not explaining this very clearly because it's not
I'm-
clear in my mind,
I'm
but I'm
tracking on
really
you.
trying to
Right.
understand this.
I'm tracking. That's a good question. I don't know how we separate that in the budget and contract that out. We'd have to, I mean, that's a,
Again, it seems are we going to have unused funds in the
I mean,
budget,
we certainly
our
revert.
personnel budget,
revert
because we
a-
have shifted these here?
Yes, ma'am.
brought down
We
additional
revert
funds.
back a pretty large sum of money each year. How much did we revert last year?
About 55 million.
Okay, so we will be looking at some reversion dollars as a result of not having these vacant positions filled, but we will have used some of those dollars that would have gone there for these private case managers. Am I getting there? All right. I have some other questions, but we have other people on the list. A quick question, and then we'll come back. But the training time, you mentioned that the privatized case managers that you're bringing on board have to be trained. We have a lot of new people that are coming on board. What is the training time for all of these folks? If we're only having private case managers for 2 years, how much of that time is going to be in training versus how much time is going to be productive? And will there be an opportunity maybe for some of these people to actually end up being hired by the state after they're trained and have been, have experience?
So their pre-service training will be 9 weeks.
For both sets of folks, both the outside, private,
Our internal folks are going to start a new training regimen, which will be 24 weeks. And that is what we understand nationally to be the new trend for best practice. The states that are looking at the lowest retention or rates, which are the highest retention rates, which are 90 to 94%, have really long pre-service trainings, which are 20 to 24 weeks. And so that's what we're modeling our state after in order to try to achieve those really, really low turnover rates. But these private case management folks, obviously, if we put them through a 24-week training process, we will have used up virtually the entire year training them.
yeah, so we have at least 6 months worth of training. And so you
Right.
still have a caseload situation for some extended period of time.
Correct.
All right, thank you. Representative Lynn, you're next on my list.
Thank you, Madam Chairman. The proposed budget includes $33 million for increasing provider placements by 166 beds, which is aimed at getting children out of DCS offices and into appropriate placements. And that sum comes to $198,000 a bed. So I am sure that is not only for 166 beds. I thought I remembered it might have been for wage increases, but can you elaborate on that?
Can you repeat the question?
Sure. The proposed budget includes $33 million for increasing provider placements by 166 beds. And that's aimed at getting children out of DCS offices and into appropriate placements. Just simple math, that's $198,000 a bed. So I'm sure that is not all that $33 million is going for. And I thought I recalled that it might have been for wage increases, but can you just elaborate on the $33 million? And on your slides, actually, if you, it's actually the number one cost increase is $33 million.
Okay, well, the $33 million, they all go towards the 166 beds increasing capacity. So
Yeah.
it is actually just whatever the rate to the providers
Wow.
for those level of service. And we just multiplied them by annualized it. That would come up to the
Okay.
$33 million exactly. So it,
Wow.
of course, that the provider has their own daily rate that has
Okay.
also increase in, they'll be subject to the rate increase. So
Okay.
the providers will be getting increase in rate
Wow.
as well But
Okay.
those 166 only
Wow.
increasing capacity.
So literally, it costs about $200,000 a year for a bed,
Oh,
which
yeah.
is, yeah, that really puts an eye for us on, preventative care, helping families, all of
Absolutely.
that
Yes.
to, help the family manage so that a
Yes.
child doesn't need to go into
Absolutely.
placement. Wow. That's really eye-opening. So thank you. How much of the problem will this address? Will children still be, sleeping in DCS offices? It is 166 beds. So, will we still have that situation? Or is that adequate to address that issue?
That's a great question. And that's something we have wrestled with internally is how many beds do we need? What will solve the
Yeah.
problem? And to be honest with you, it's a moving target
Yeah.
because we don't control the front door. We don't control how many kids come into custody. Frankly, on any given day, I can't give you an exact number. And that's very frustrating for us. And I know it's very frustrating for the General Assembly as well. I am happy to tell you, though, that we no longer have children sleeping in offices, with the exception of Shelby County. So nowhere in the
Yeah.
state, as of about 2 weeks ago, is any child sleeping in a DCS office.
Yeah.
They're all in transitional homes and Isaiah houses. So I think that's the good news is we have 25 transitional homes and Isaiah houses where children are sleeping and have access to bedrooms and beds and showers. And we are close to a solution in Shelby County as well. So I'm
Okay.
very hopeful in the next probably 30 to 60 days that will be solved as well.
Right.
And that no more children are sleeping in offices,
Right.
state office buildings.
Mhm.
I think that what we're putting forth in the way of assessment homes, increased provider rates, and increased placement rates is going to be a lot of progress. It's going to move the needle. I'm going to know more at the end of the summer and next fall
Mhm.
about where we are and
Okay.
and how close this gets us to sort of solving the problem.
Right.
But understand this is always going to be a moving target.
Right.
With where like it's a seesaw.
Okay.
And it's going to look better some months or some years than other years, depending on how many kids come into custody and what the variables are. And some of those, obviously, DCS doesn't control.
Right. And another part to the question.
Certainly, Representative Lynn.
Thank you very much. Personally, I felt like, yes, we'd love for them to be in a provider bed, but as long as they were safe, that is wonderful, even if they are in a DCS office. But what we want to know is, what about their care when they're in the DCS office? Do you have policies and procedures in place to ensure that, the children are provided adequate care? Are there guidelines for when that situation happens and they have to stay overnight in an office? Formal guidelines that the employees have been trained on when that has to happen, if that has to happen.
We do have guidelines that have been put out for when children are sleeping in transitional homes. And again, they're not in offices anymore. They're in transitional homes. I think, obviously, this has been a very difficult season for DCS. The needs of the children, the acuity of the children that we are caring for is high.
Yeah.
The training and the skills that our DCS caseworkers have do not meet the needs of these children.
Yeah.
We are not hiring behavioral health specialists. We are not hiring psychiatrists. We do not have the facilities to meet the needs of these children. And that's why it's important to get them into placement as quickly as possible. That's why we have been asking for what we're asking for, which is to increase the provider rates and increase funding for placement. That's why the need is critical now, and why we are asking for the supplemental and so forth. We don't have the facilities to meet the needs of these children. We don't have the skills necessary in the case managers. When dependent neglect children are mixed with juvenile justice children in the
Yeah.
same home,
Yeah.
it is a bad combination. when you have dependent neglect children who have been charged with delinquent offenses, but not yet adjudicated, mixed with dependent neglect children
Mhm.
who are treating dependent neglect children, it's a bad combination. In one region, we're making decisions about where to put children based on charging partners and safety and gang affiliations. And it's not appropriate. And we do not have the facilities that we need in order to house children outside of true placement options.
Yeah.
We just don't have the facilities. And so right now we're waiting on Ernst & Young, who has been engaged in a real estate assessment for DCS. We were hoping to have that report out to us by the end of February. We're hoping by March 10th, they will return their report to the General Assembly, and they will give us recommendations on what we need to do and where we need to go. Do we need to build? Do we need to renovate? Do we need to modify? What do we need to do to prepare DCS for the future and how to care for these children and what facilities we need to prepare to care for the children of 2023 and beyond. We do not have the facilities to care for the children that we are bringing into custody. We don't. We have a system built for the needs of the children that we cared for 20, 25 years ago, not for the needs of the children we have today.
Yeah.
We just don't.
Well, Commissioner, I just would like to conclude with my thanks and expressing my thanks from my district for you and for your entire staff. And I'm so happy you brought them all because thank you. You're truly doing God's work. And I want you to know we really appreciate it. So thank
And
you.
I appreciate your questions and you giving me the opportunity to talk to you about that. I wish I had a better answer for you. And I really do. We're not doing all that we want to be able to do. And we're here looking for a better solution. So thank you.
I think we're all very interested in trying to find better solutions. Leader Lambert.
Try to make a connection there for me if you don't mind.
Leader, I would love to be able to tell you what happened 2 years ago, but I, of course, wasn't here two years ago.
I'll give it a try. Okay, so most of the reversion came from payroll savings, which happened because the positions were vacant. And these positions are assigned in the budget to staff. So I can't take those positions, I can't take the funding from a position and assign it to another line items in the budget. So that was one of the big items actually that happened in the payroll savings. And the second item is a temporary item that I cannot know when it will end, which was the enhanced rate that the feds give the state. It's 6.2% extra for the federal participation rate, and that can end at any time, and nobody really can predict when it will end. As a matter of fact, when we did the budget, any year we do the budget, we cannot anticipate that will continue because actually just the president came and ended those. It's going to be ended actually in somewhere in December. So when we do the budget, we do it for at least a year in advance, and we cannot predict what this pandemic money or enhanced funding will continue or not.
look at that and figure out kind of where those things are coming from. And if there are barriers that are going to keep you from being able to fill those positions, please let us know about that. Because I mean, I know you're taking kind of a fresh look at all of it, and I think that's a good thing. But if there are things like that that are keeping you from being able to use funds and use reserves and use money that would be reverted to solve a problem that you know is there, I don't know what the answer to that is. But if there's areas that we need to give you guys a little more latitude to move that around, I personally would love to know that. So just, and again, I know you're taking a look at everything top to bottom. We appreciate that. But as you do that, let's look at what has happened before and see if we've got this much in reversion, surely there's something we could have done or can do in the future to help that solve a problem. Thank you, Madam Chairman.
Yes, sir. Thank you.
And while we're talking about salaries and dollars, because that really is what we're considering here, and these reversion dollars are because of the exit of folks doing the hard work, which you have folks from across the state out here who represent those workers, and I've neglected to mention how grateful we are to them. We send messages, but it's good to have you with us so we can say we truly do appreciate the work that you do across the state every day to deal with very difficult situations with our children and our families. So thank you. When we've talked a lot about the salary market rate adjustments, but we also, there were some bonuses that were handed out, I guess, year end. And help me understand, did HR give guidelines to the department on how those bonuses were to be distributed? Was it a departmental decision? And those are, I assume, bonuses, which implies a one-time, non-recurring expense. So help me understand how those came down and how they, what the decision-making process was in determining the distribution.
Before my Assistant Director El Casey answers that question, I want to reiterate that one of the reasons that we adjusted the ranges, and we worked really closely with Commissioner Williams at DOHR to adjust the entire case manager series range. And I want to draw particular attention to the fact that no case manager is within $10,000 at the top of the range, because what we saw in the veteran case with these veteran case managers who really are soldiering much of the load right now while we're trying to hire, is that they were maxed out. They were at the top of the range. And so they were only ever getting bonuses at the end of the year. They were not receiving raises anymore. Once you hit the top of the range, you don't get raises. You just get a one-time bonus. And so what we did was raise the range, so they are now eligible for raises again instead of one-time bonuses. And I think that was a really important part of what we did with the case manager series. I'll let
And I understand, because that is the compression issue that
Correct.
we always have to deal with.
exactly.
So I understand that those ranges were increased, but in addition to
Yes.
that, there were still bonuses that were handed out, and I'm just trying to understand the distribution methodology for those bonuses.
So when the market study came in, it actually suggested a beginning salary for case managers, 1 and 2 and 3, all the way to the end. So those particular begin salary it's put most of our case managers at the beginning salaries. The goal really was to get them to midpoint, and that was really the commissioner target, was to get staff at midpoint, where case manager 1 start at 50,600 and all the way to team leader or team coordinator started at 76,600. So when distribution happened, we try to get the existing staff with filled position to those rates. And in the meantime, when we did that, there was some case managers already at these rates. So we did also offer them a 3%, and that's what we can call it, an additional increase to the salary. And the pay for performance, this is that happens in January. Then that's actually determined by the DOHR, and we don't determine that. Is based on your rating, and that actually happened to all staff, not just case managers.
And that brings up a point, because when I look on the Transparent Tennessee and look at the bonuses in DCS, there's a high of around 6,500, a low of $73. And it seems that most of the case managers are sort of in the $2,000 range. And I would have assumed that with case managers being where the rubber meets the road and where we're attempting to entice more people in or keep people already there, that there might have been a different kind of distribution, so that the bonuses would have been, I guess, more generous in that group. But that's something that we can talk about later. But it's something I'm really would like to have an offline conversation with you all to get my head around how some folks, and I'm not saying that it's not deserved, but that folks at the administrative level got a significantly higher bonus than the folks that we're walking out the door that we're trying to keep. So we can talk about that on another day. Representative Garrett, you're recognized.
Thank you, Madam Chair. Appreciate you all being here today and your staff. I've got a question regarding the Safe Baby Court expansion. In the proposed budget, which includes just over $1 million recurring funding for up to 7 additional safe baby courts across the state. Safe baby courts, as you all are, I'm sure, well aware, provide services to drug-exposed children and their families. The aim is to use the funding to expand 7 sites across Tennessee and cover all 12 regions. So I have the following questions that relate to that. Will there be barriers to the participation of all 7 sites, followed by are all judges and necessary partners already on board with creating safe baby courts in their jurisdictions? And then finally, what happens to the funding if the department is unable to create all 7 sites? Will it be distributed among existing sites, or will it return to the general fund? So if you could enlighten us on the status of the expansion of the safe baby courts, I know this committee would be appreciative.
So to back up just a little bit, so the Administrative Office of the Courts will consult with DCS, the Department of Mental Health and Substance Abuse, and the Council of Juvenile Court and Family Court Judges to determine the location of each of the safe baby courts. There's a long list of folks that are waiting and have requested to have a safe baby court. So I'd be surprised if we don't have folks waiting in line to get these courts. So I would doubt if we are so fortunate as to receive the funding for this, that we would have to revert the money back. We have a pretty long wait list of counties that are asking for these courts. And I can read them off to you if you're interested in hearing the counties that are on the list: Campbell, Morgan, Roane, Robertson, Greene, Washington, Shelby, Blount, Sevier, Franklin, Hickman, Lawrence, Perry, Wayne, Haywood, Bradley, Hamilton, DeKalb, Macon, Putnam, and Warren. Those are the counties that are on the wait list to get a safe baby court. So these agencies will work together with the counties that are on the wait list to see where we can put these safe baby courts.
And thank you, Madam Chair. And so do you, even though it seems like there's more on the list than we're funding at the current time, do we see, so the 7 that we're planning on expanding, I think we're going to meet that need, but do you see any barriers to making sure we can have those safe baby courts for however those counties fall on the priority list?
I see no barriers.
Good. All right. Great. Thank you very much for that. I really appreciate it, guys. Thank
Yes,
you for
sir.
being here.
Representative McKenzie.
Thank you, Madam Chair. And I'd like to pick up on a line that Representative Gann had started, and that's on the relative caregiver program. First, quick question. I know there was some earlier legislation. I forgot what ended up passing. Is that a pilot program or is it a permanent program?
It's a permanent program. Yes,
Okay.
sir.
And so my second question to that is, and I spoke to you all last time about how I really feel that that is a key component of getting our children in loving hands and loving, caring hands. Have you given any consideration, not this year's budget, next year's budget, to increasing that I forgot what it's a percent of poverty, to increasing that somewhat, to open that gate up just a little more, because they're only getting half, right? So to increasing that gate to allow more aunts, uncles, grandmamas, people like that to participate.
So relatives can apply to be foster parents. They can, as long as they meet the requirements. The federal government requires foster parents to go through certain requirements in order for us to pay the foster care rate. And obviously, we're happy to put them through that process if that's what they want to do. But we hope that obviously relatives are, when relatives are appropriate and we can find relatives and understand that we are required by federal law and it's the best thing for children when that works out. We are constantly looking for relatives and caregivers to take custody of children when children come into custody.
Representative McKenzie?
Thank you, Madam Chair. I fully understand that, but a lot of times, just as you are, and I'm talking to you guys are definitely the choir here. It's a dynamic situation, right? The inner workings of that family and that parent, or the actual birth parent. Sometimes maybe that relative don't want them to become wards of the state, right? And that's that requirement, that's that hurdle that's sometimes too high to cross because of internal conflict, or they just don't want that, but they want to provide for these children. Again, like I said, I'm just really encouraging you all to actively pursue that one, because I really think that'll solve a lot of these, especially with some of these, delinquent type behaviors. Sometimes it's that auntie might have a better opportunity to correcting that behavior. Not sometimes, a lot of times that happens. So just how would you respond to that? And then I have one more question.
I mean, currently it is 200% of the poverty rate, and that came on the legislation. So we have to follow that particular requirement. If we want to increase that number, we'd be just changing in the legislation and state instead of 200%, it can. I mean, it is a possibility, but at the time where it was determined, that was the rate that was determined in the law.
Representative McKenzie?
Thank you, and thank you for that. I forgot the percentage, but I knew it was a percent of that. But thank you. My last kind of line of questions kind of gets to the. You said something during your opening presentation about the privatized piece of it. Now I'm kind of bringing up that dead horse again, but I'm attacking a different part of it. So I heard you say that you looked at Florida, and I forgot the other state, for what they're doing, and they're fully privatized. That gave me pause, because we're also training folks up, right? And we're increasing the state employees. And I'm a firm believer that someone who has skin in the game would be better at it. I know, people like privatization, and I don't know if that's the case. So I want to assure myself that that's not the long range plan. So that's one piece. And then when I looked at it, even with you saying $125,000 for that privatized account, but it includes administrative costs. In my corporate kind of environment, if we're paying $60,000 and it's $125,000 or $75,000 and it's $125,000, that's a considerable amount of overhead. So that overhead cost, I agree, administrative and health insurance, all that, but that's still a pretty significant cost. So if you could address those two things, are you planning on, is that the point blank, is that your goal or is not your goal in terms of privatization? I'd like to get a clear answer on that. And then have you really looked at those overhead accounts
and what we're getting for that $125K per employee.
Thank you. I would say 100% that is not my goal, is to privatize Tennessee's case management system. I used Florida and Missouri. They 100% case, they privatized. This sounds like a cop-out, but this was in the budget when I got here. Commissioner Nichols had already started on the budget when I had gotten here, and she had put this in the budget when I got here. She and I did an overlap for a couple of weeks in August. And so these rates were already factored when I got here. But I do know that having been a state employee for 21 years prior to assuming this role, that when you factor a state employee's job rate, you are not just factoring their salary, you're factoring their cubicle and their pension and their supervisory, their supervisor and their support staff and everything that goes along with that. And so on the privatization side, we're also factoring not just the administrative support around them, but their supervisors. And so it looks like a fairly big rate, but there's a lot that we factored, I think, around that rate. But to go back to your first question, I am absolutely not, and I've said in previous hearings on the record, I'm not going to be advocating for privatizing DCS's case management. I do not think putting all your eggs in one basket is ever a good idea.
Representative Shaw. Oh, well, Representative Shaw took a break. Representative Sparks.
Thank you, Chairman, and thank you, Commissioner. Thank you, your staff and those social workers that are kind of unsung heroes. One of my representatives over here mentioned God's work. You're truly doing God's work. You mentioned Isaiah 117. I happened to be at a thing with the Sheriff's Department where we had a young little 3-year-old, Riley. I don't know if you know the situation. Her mother was murdered, and watched the good work that the Sheriff Department did to try to help support that child. And I watched Isaiah House, and I seen some of what they're doing. I guess the founders is it Rhonda and Corey Paulson? Yeah. So just shout out to them and the good work they do. What are we doing to try to leverage those resources with nonprofits to be a support staff?
Thank you for that. It's a great question. And I will say that I think the faith-based community has really answered the call for us. We would not be out of offices were it not for the faith-based community. We are out of offices. Our children are not sleeping in offices today because the faith-based community has stepped up. We are in transitional homes and in Isaiah 117 homes. And if we can get out of the offices in Shelby County, it is because the faith-based community in Shelby County will have stepped up and helped us procure temporary housing locations in Shelby County. And we are very grateful for their assistance and their charity in that way. And I am very, very pleased that we no longer have children sleeping in offices.
Yes, ma'am.
In East and Middle Tennessee.
Yes, ma'am. Well, their motto, if I could share it, Chair Lady, is learn to do right, seek justice, defend the oppressed, take up the cause of the fatherless, and plead the case of the widow, Isaiah 117. Thank you for your comments, ma'am.
Yes, sir.
Representative Miller.
Thank you, Madam Chair. Commissioner, thank you and your team. In your comments, you mentioned 25 years. You was talking about 25 years and some standards. Was that in reference to facilities? Could you?
I think I said we have 25, did I say 25 years? We have 25 transitional homes.
Okay, didn't have anything to do with the things that were going on 25 years ago that continue to go on today. A couple of general questions. The number of children and qualified by age range that are currently within the Department of Children's Services, in all divisions?
Birth to 18, birth to 19.
Okay. And currently, what is the total number of that? I'm just,
We have about 8,900 children in custody, and that includes dependent neglect and juvenile justice.
are those numbers, do they increase over the years, or are you experiencing a decrease, or?
Since about 2019, 2020, those numbers, except for 2020 is a little bit of an anomaly, they've been holding pretty steady.
Okay. And you also mentioned facilities, that the department needs more facilities.
Here are your trends right up here.
Okay. The department needs more facilities. You mentioned that.
The
correct?
department is woefully full up, not to use a slang term, but we are very full.
Was that mentioned in your budget to the governor about?
Yes, sir.
wanting
The governor is aware that we are full. We're waiting on this Ernst & Young real estate assessment that's been going on for about 12 weeks.
It's okay. Thank you. Thank
Yes,
you,
sir.
Madam Chair.
All right. Commissioner, Chairman Hawk had to step out, but he had a question about the retention. You mentioned you have, of the new employees that you have, the retention rate was really high, that 98%. Over what period?
From January 1.
So they're still in training, I'm assuming, unless somebody you hired was experienced and they,
Yes,
So-
sir. But in previous years, they would drop out even in training.
what kind of, I'm assuming we did exit interviews with folks who left during the Great Exodus, and salary obviously is an issue, caseload obviously is an issue. What other issues rose to the surface as to why these people were choosing to abandon that line of work?
If they drop out in training, what we hear most often is it just wasn't what I thought it was going to be. It was more than what I thought it was going to be. Money is a factor. When they get a little further into the job in the first year, it's work overload. It's leadership and supervision, and then money. Those are the three common exit interviews. And obviously, we have a lot of exit data, and we are looking at that all the time through DOHR.
And I guess I'm hopeful that you are continuing to look at that data
Weekly.
and to provide additional shore up areas. You mentioned leadership is sometimes an issue. So training, not only for the folks who are coming in, but additional professional development for those that you have on staff.
Yes, ma'am. We're about to start a whole leadership series for team leaders all the way through deputy commissioners for the entire leadership staff at DCS that DOHR is helping us implement. And if I could return to a previous question, the bonuses are a percentage of your salary, and that's decided through DOHR. So that's why you see the lower end case managers with a smaller bonuses and say deputy commissioners with a larger bonus, is because it's a formula and it's a percentage of your salary.
And that was my initial question, but I didn't get an answer that told me that's why I pursued it. So
That's the answer to your question.
thank you.
Yeah.
I don't see any other questions on my list, Chairman Hawk. I just hopefully ask your question for you. And with that, we thank you for coming. And again, to the people who are in from across the state who don't normally have the opportunity or the challenge, whichever you may view it, to attend one of these hearings, we appreciate you being here today. Thank you so much. We're going to ask Director Kennedy if he would to come forward. Our next presentation is from the Commission on Children and Youth. Director, thank you for being here and thank you for your patience. As you saw, there are a lot of interest and a lot of questions with our previous department, as I'm sure there may be with yours as well. So welcome this morning.
All right, I think that's better now. You would think I would have this down by now. Good morning, Chair Lady and members of the committee. Thank you all so much for the opportunity to be before you all this morning to talk about the work of the Commission on Children and Youth and our budget this year. My name is Richard Kennedy, and I have the great privilege to serve as the Executive Director of the organization. I have several folks that are with me today. Immediately to my right is Craig Hargrove, who serves as the Deputy Executive Director for the agency. To Craig's right is Sherry Isom, who is the Director of Finance and Operations for the agency. To my left is Kylie Graves, who serves as the agency's policy specialist and one of the many data folks that we have on staff. And I'm really fortunate that we have a new staff person, a grants manager, Marquita Moore, who is joining us in the office. So during my short time with you all this morning, I have three goals for my comments. First is to remind you of the work of the commission. Second is to talk about the agency's budget improvement requests. And then really third is to answer any questions that you all have about our work. So to remind you all that when we think about children and youth in Tennessee, we think about children and youth living in a system where there are so many touch points with entities and organizations that provide services and supports for them. So we have nonprofits and communities like Boy Scouts and Girl Scouts and Big Brothers and Big Sisters. We have service providers that are mental health service providers or medical providers in communities. We have state partners, whether it's the Department of Education or the Department of Human Services or the Department of Children's Services. We have organizations like the Tennessee Wildlife Resource Agency that provides services to children, youth, and families. So when I talk about the work that we do at the Commission on Children and Youth, the Commission really is that entity that swims between all of those organizations to bring people together, to really use data to look at what are we doing well in Tennessee, where are there opportunities for us to improve outcomes, and what can we learn from other states that are doing the same kind of work that we are all doing. To remind you all that the Commission is a small state agency. We have a staff of 30. We are a little bit different than the cabinet level agencies in that we are governed by a board of 21 commission members. Each of those commission members are appointed by the governor, and there are a variety of requirements or check boxes that we have to meet both statutorily and federally for that composition. With the work that we do, there are several programs and strategies that live with us. One of the ways that you all probably interact more with Commission on Children and Youth in your districts is that we have 9 regional councils on children and youth, and each of those regional councils has a full-time staff person that's responsible for bringing together any interested citizen in that part of the state to learn from each other, to identify gaps in services in that particular part of the state, and really to create that synergy opportunity so that folks can take what they have, learn from each other, and make life better. We serve as the Annie Casey Foundation's Kids Count partner in Tennessee. You all will probably remember that about once a year you'll hear Tennessee ranks whatever in child well-being. And so currently we are ranked 36th in the country. So we work with the foundation to share data to really be able to allow the foundation to compare cross states in a couple of indicators. We have a strategy that's Kids Central that I'll talk about in a little bit. really involved in the youth justice work. We have a partnership with the Department of Mental Health and Substance Abuse Services to coordinate a council on children's mental health. We have the Second Look Commission that you guys created statutorily several years ago that is attached to the commission. We have a Youth Transitions Advisory Council that's looking at young people who are aging out of the foster care system and any challenges or opportunities they have in making that successful transition to adulthood. We have a Home Visiting Leadership Alliance that's a partnership with the Department of Health, an ombudsman. We have a Young Child Wellness Council. We are doing a lot of work around building resilience in communities. And one of the newer strategies that we have is a strategy that's called the Best Place for Working Parents Partnership with an organization to really engage the business community in ways that we have not done in the past. So with the commission's budget, we have a budget of $6.39 million. Of those funds, $2.2 million are pass-through funds that the agency grants to court-appointed special advocates programs across the state, and then federal juvenile justice dollars that are granted to delinquency reduction programs across the state. Our budget's comprised of $4.1 million state dollars, $1.7 million in federal funds, and $1.8 million in funds from other sources, including some of the partnerships that I talked about that have interdepartmental contracts. So with the commission, we have right now, currently we have a staff of 30. And so you'll see a decline over a couple of years. So in 2019, we had 34 positions. 3 of those positions went away because it was an interdepartmental grant funding opportunity with the Department of Mental Health and Substance Abuse Services. And when those dollars ended, so did the positions to help support that work. In 2000, I can't see well, but the second reduction was when we abolished a vacant position that had been vacant for a while. So as I said, we are at 30%. Can we go to the next slide instead? So in our budget improvement request this year, there were 2 increases that we asked for. So the very first increase that we asked for really came from a conversation that I had with Senator Hale earlier in the summer. And so as you all know, Senator Hale's been really focused on all things children and youth and adoption and foster care this year. And one of the things that he said to me during that conversation was, he said, Richard, there are a lot of services for children and youth across the state. We spend a lot of money and invest a lot of money in that space. But sometimes it's very difficult for citizens to know how to access those services in an easy way. So he said, would you imagine what a children, youth, and new families navigator program could look like, that it would allow a citizen to pick up a phone and call and say, hey, I need help finding childcare, or hey, I need help finding a job, and how could we do that? So we put together a proposal and included that in our improvement request. So this is going to be an unusual year, and that I'm going to tell you that it was not included in the governor's budget, and we don't need it from you guys. So the reason that we don't need it from you guys is that, and can we go forward one more? So one of the things that is in the governor's budget this year is a reduction in some funding and a staff position with us at the Commission on Children and Youth. So during Governor Haslam's administration, in his children's cabinet, there was a great amount of focus on creating a website that was called Kids, or that is called Kids Central TN. And so at the end of the administration, they embedded the work of Kids Central with us at the commission to continue to move that work forward. So it's our understanding that there is a similar strategy at the Department of Human Services to create something that is like that Navigator program. So the governor's budget, like I said, recommends removing the Kids Central work from the commission and transferring it to DHS along with the staff person to do that. I will never sit before you guys and complain about something that's going to be good for kids and families. And I truly believe this will be a good thing for kids and families. So if I go back to my second budget request this year, it is a perennial request that we have of you all, have had for the last couple of years. Being a small staff, that means we have a small fiscal shop. And so even though we have a small budget compared to many cabinet level agencies, we have a lot of contracts. And so I am asking for a contract manager position. Right now, our folks do a stellar job, but I worry about separation of duties. So we have folks that are developing contracts, that are reviewing invoices, that are approving payment of invoices. And so one more person in our finance shop would really create that separation of duty, allow more for more efficient, effective oversight of the work that we do. And quite honestly, I am fearful that the comptroller's office is going to say, Richard, you have a problem one day. And I want to be able to say, we agree, and here are some strategies that we have been trying to implement to solve that. So as always, I appreciate the opportunity, and I am more than happy to try to answer any questions you all may have.
And Director, thank you. I think I missed a piece of the presentation there. This contract oversight, which obviously I think any audit is going to tell you that you require. Is that included in the budget as presented?
No, ma'am, it is not. It was not included.
All right, thank you. Questions beginning with Chairman Williams.
Thank you. Thank you, Director, for coming today. Just had a question about CASA.
Yes, sir.
Last year we saw I think it's a little over 200 or maybe $200,000 for expansion efforts.
That's right.
For CASA. I think based upon the formulary or the expectation, we felt like we could possibly expand services for CASA across the state and possibility of adding 9 new programs. Wondered if you could give me an update on where we are with CASA, where those funds were expended. I'll give you a chance to answer that and maybe a follow-up.
Yes, sir. So first, thank you all so much for that investment in CASA and the Court-Appointed Special Advocates Program. So as you said, there was $200,000 that was added to the commission's budget that we passed through to the Tennessee CASA Association. And so right now there are 56 counties that are being served with by CASA programs, and each of those received $22,000. So with the $200,000 investment that you guys provided last year, there are 3 new counties that have come online. So Haywood, Warren, and Hickman County has come online, and I'm understanding that the Tennessee CASA Association is dangerously close to having a 4th county, which will be Carroll County.
So I guess the whole impetus behind giving these additional resources is because there were only a majority of counties that actually had a CASA program. The idea is we were going to expand those.
Yes, sir.
As I said previously, I was thinking that additional money could get us to 9. Is there some impediment to getting this done? Is it not enough money? Is there not enough local advocates maybe to do it? Just wondering how, a year later, we're, 50% on the way to growing the program across the state, and wonder if maybe you could help me understand that better.
Yes, sir. And thank you for the opportunity. That's a great question. So the Court-Appointed Special Advocates Program, as you guys all know, are community-based, locally based, volunteer driven organizations. And so the dollars that go to the CASA programs are really to support some professional staff that will be able to recruit the volunteers, and then to be able to provide that supervision and oversight of the volunteers to be able to work with the courts. So I hate to use the word impediments with this. So there are certainly some opportunities and hurdles that have to be cleared in order for a CASA program to exist. So the first thing that's the most important thing that has to be in place is the juvenile court judge in the county has to want a CASA program. And so there are some judges that are like, absolutely, we want a CASA program. It's the best thing in the world. There are some judges that are like, not sure yet, want to learn a little bit more before I make that decision. And so as you all know, there were judicial elections recently as well. So there are many new juvenile court judges that are across the state. So that's one of the first things that has to happen, is that community convincing of the judges. The second thing that has to happen is there have to be the community volunteers and the leadership in the communities. They want to step forward and do that. And a large part of that is really raising the money to support the programs, because as I said, right now, each of the counties get $22,000. And we know that's not enough to provide the staff to be able to do that work. So communities, especially rural communities and poor communities, they get a little anxious when they say, okay, we're going to have to raise even $100,000. How do we we do that from the communities. So I think that those are some of the continuing strategies that have to be looked at to be able to build a program, and then quite honestly, to be able to maintain some of the programs that are out there as well.
One final.
Chairman Williams.
Thank you. So do you believe do you have the capacity within your commission to train those people if in fact you were able to overcome the speed bump of judiciary or overcome the ideas of volunteers? It's so the lack of growth is not a commission capacity problem.
So, Representative, thank you so much for asking that question. I did not ask you to ask me that question, but it is a perfect question. So, one of the things that I want to be really, really clear about is the Commission on Children and Youth is not the Tennessee CASA Association, and we do not operate the local CASA programs across the state. We are simply the entity that the dollars pass through to contract with those organizations. So what we see our role in the contract management is you guys will give us the money. We will look at all of the scopes of service that we want the Tennessee CASA Association to deliver on and the scopes of service that we expect from the local programs. And once they, once they have a contract with us, those dollars go to them. So the Tennessee CASA Association has their own board of directors, and the local CASA programs have their own community boards of directors as well. Now, in saying that, I truly believe that the CASA programs make a difference in the lives of kids and families across Tennessee, and I think it's an effective and efficient use of money in Tennessee. But the capacity of the development really lives within the Tennessee CASA Association. And so I would say they may have a different opinion, but I would say right now they have the capacity to continue the expansion of the work. Maybe not as quickly as we'd like, but still have the expansion. Now, where I do worry is, much as you guys heard during Commissioner Quinn's presentation, the workforce has been an interesting place all across the state for the last couple of years. And the directors of the CASA programs, by and large, are not highly compensated individuals, and many of them do not even have benefits through their work. So I worry that the $22,000 that you guys are giving to us to give to them of state dollars, I'm fearful that is going to ultimately start to create some challenges in maintaining leadership in those organizations.
I don't have a question, but I do have a comment in this area, and an area of significant concern to me. I've had meetings with the Tennessee CASA director and the chair of their board in my office to try and understand the use of the $200,000 additional dollars that we put into the state program, understanding that the $22,000 per CASA is a separate budgetary item, and we can have lots of conversation about, whether that needs to be increased. I think when we put those additional dollars in the budget, my expectation, and I believe the expectation of most of my colleagues, would be that those dollars would be used to expand programs. I asked for a breakdown of how those dollars were spent, and $125,000 of it, $124,000 of it was spent in salaries. $76,000 were allocated for professional fees for local programs, supplies, and travel. I am not disputing the fact that perhaps folks were underpaid, but having all of those dollars go directly to salary, and there's an issue with the breakdown of that salary too. The director's salary is more than twice any other employee's salary. So just for the record, I really have some serious concerns about that, not really asking for an answer or comment, but just to put that on the record so that my colleagues understand. If we do additional dollars in this area, I think we need to be careful about how we direct them. So with that, Chairman Hawk.
Thank you, Madam Chair. And Richard, we've known each other a long time, so
Yes,
thank
sir.
you. You've got the screen up, the pages 7 and 8 of your presentation. Help me understand what is being funded and what's not being funded. And specifically, I'm looking at that contract manager position, the $108,700 that
Yes, sir.
would benefit the organization. So we do have that separation. How, all that being said, tell me how many contracts TCCY is handling over a year's time, and exactly what is funded on those 2 pages and what is not being funded on those 2 pages.
Yes, sir. So, so I'll do a run at the first or the last question, and then ask Sherry to talk about the contracts part of it. So those were both of the improvement requests. Neither of those were included in the governor's budget. The Children, Youth, and Families Navigator, we do not need that funding, as the Department of Human Services is working with the governor's office to develop a strategy to create the opportunity to fix what we were proposing in that. The contract manager position was not funded, but that is something that I would dearly love for us to have. And Sherry can answer the question about the contracts for you.
Good morning. Currently, for the current fiscal year, we are managing 73 contracts in total.
Representative Barrett.
Thank you, Madam Chair. Good morning, sir. How are you?
I'm well, thanks. How are you, sir?
I'm doing well. On the questionnaire that was submitted, I noticed that there are 2 areas that were budgeted in 21-22, but do not have any money budgeted in 22-23. That's going to be your Office of Criminal Justice Programs and 0 to 3. Can you tell us why that is? Are those programs now complete and done, or is there some update that you need to give to the committee?
Yes, sir. So yes to both of those programs are complete and done. So the funding from the Office of Criminal Justice Programs was we were reached out to by OCJP, a year and a half ago. My time's starting to run together. But it was really kind of during the end of the pandemic. And so what they talked with us about is they said, hey, we have some federal dollars. And one of the things that we want to do is we want to invest those dollars into a public awareness campaign that will help prevent child abuse in Tennessee and connect Tennesseans with resources that are available. And they said, can you all do that? And so my response to them was, that's not something we've done in the past, but we can certainly work together to figure that out. So they provided some funding for us to be able to work with a consultant, really a media company, to do a whole public awareness campaign. And it was really kind of, quite honestly, focused on business communities and helping business communities be aware and mindful of the climate and the policies they have in place. So it was a whole strategy that was called What Happens Here Matters There. So out of that work, we still have all of the collateral, all of the social media and the ads and all of those things. But when that funding ended, when that grant ended, so did that work, except for continuing to use some of the pieces as appropriate. Very similar to 0 to 3. So 0 to 3 is a national nonprofit organization. And so they are very focused on issues impacting the youngest citizens of the country, the kind of, well, as their title says, the kind of birth to 3, 0 to 3. And because the commission coordinates with the Department of Health, the Tennessee Young Child Wellness Council, we had an opportunity to, through that council, to apply for some funding to help bring folks together to really look at the whole early childhood system in Tennessee. And so again, once that grant funding ended, we no longer had access to those dollars, but the work continues through the Young Child Wellness Council.
Thank you.
Don't have any further questions on my list. Thank you for the work that's done in your organization, coordinating lots of different moving parts with lots of different state agencies to make sure that we're doing the best we can for our children and youth in Tennessee. We're going to ask Director Dunn to come forward now and present us with the information he'd like to share on the Commission on Aging and Disabilities. Certainly, Representative Shaw, you recognized.
Thank you, Madam Chair. I'd like for the committee to help me make welcome this morning Mr. Bill Brewer from Jackson, who is in the room. I think I saw him back there. My eyes are doing right. And we thank you for being here, Bill. Can you make him welcome?
Welcome, Mr. Brewer, and welcome, Director Dunn.
Thank you so much, Chairman. And thank you for the great work that you do, and to this entire committee for the great work that you do on behalf of Tennessee. It means a lot to me personally. It means a lot to me professionally. We have with us today Gail Wilson, who is our fiscal director. Next to me is Mason Devers, and then we have Ross Ferguson out here. Ross and Mason are our legislative liaisons. I hope that you'll call on them to help you anytime that you might need help. And of course, as always, call on me directly. I'll try to move through these remarks rather quickly, Chairman, so that we can open up for questions. As Tennessee's designated state unit on aging, TCAT is the foremost agency providing leadership on aging issues. Our mission strives to help aging Tennesseans remain independent and healthy in their homes as long as possible. For the upcoming fiscal year, the administration has proposed a $300,000 increase in recurring state funds. This funding is to further increase reimbursement rates for direct care workers that our non-AAADs contract with to deliver services. Below market rates have contributed to labor shortages. Labor shortages are a common theme across all job sectors, and our industry is experiencing them as well. Last year, TCAT increased reimbursement rates for direct service workers and meal providers who contract with the AAAD network. These funds will help us continue this and work toward a more robust workforce to serve our aging population. TCAT currently sits on a task force led by the Department of Labor to study reimbursement rates, and I look forward to those findings. I want to thank also Chairman Hazelwood for leading the legislation that actually enacted that task force. TCAT has no supplemental request for fiscal year 24. To meet our requested 1% reduction, we have proposed meeting that through a reduction in the state options program, which would total $276,800. The governor's proposed FY 23-24 base budget for the Commission on Aging and Disability totals $81,316,300. TCAT's programs are largely federally funded under the United States Older Americans Act, which accounts for 65% of the total base amount. TCAT was established by the General Assembly in 1963 as the Commission on Aging. A lot has changed since the 1960s. Adults with disabilities under 60 were added to our jurisdiction in 2001. New state programs have been enacted. And in 2021, I became the first executive director appointed by the governor. While it's nice to take a stroll down memory lane, I think the most important direction to focus on is the future. Older adults represent the fastest growing demographic in our state. Currently, nearly 1.7 million Tennesseans are 60 and older. With current projections, there will be 1.9 million by the end of the decade. In 2034, the U.S. Census Bureau projects that for the first time, those 65 and older will outnumber those 18 and under for the first time in our history. The administration and this Tennessee General Assembly have made tremendous progress as a champion for the aging population. We established new services for those affected by Alzheimer's disease, doubled funding for home and community-based services, and increased nutrition meal rates for providers for the first time in a long time. All these efforts, which are pre-Medicaid services, save taxpayers dollars and enable our aging citizens to live at home longer so that they don't have to enter long-term care facilities earlier than needed. A few highlights, Madam Chairman. Home and community-based services, those are up 180% over the last 4 years. Meals, those are up 230% over the last 4 years. The State Long-Term Care Ombudsman Program, they conducted an additional 3,000 visits year over year from last year. The Tennessee Person-Centered Music Program, which assists patients in long-term care facilities through music therapy, had only served 23 people when I was first appointed. Today, I'm proud to say that their program serves over 500 patients across 100 facilities, and we are seeing value. 17% of those patients have experienced a decrease in their antipsychotic drug rate. 3.9% have experienced a decrease in depressive symptoms. 8.7% decrease in hospitalization rates among those patients served. Nursing home staff have reported that 83% of these patients participating have experienced improvements in their quality of life. Volunteers, year over year, we're up 2,000. The public guardianship program, which we house, we're up 12%. Senior center grants, 125 $8,000 grants were awarded to individual senior centers across the state, thanks to the additional $600,000 increase from the Tennessee General Assembly. These centers make up 89 counties, 94% of the state. This is 30 more counties than last year. The past few years have been challenging, and we have done more with almost no increases in personnel. We have more work to do to meet the needs of this growing population, and I look forward to joining our state and local leaders as we prepare for the future. With that, Madam Chairman, I'm happy to answer any questions the committee may have.
Thank you, Commissioner Dunn. It's good to see you again. We've worked together in several capacities, and it's nice to see you and your team. We do have some questions for you. Maybe I'll start off here. In the most recent fiscal year, your commission was awarded almost $900,000 to register unlicensed facilities. And I guess my first question is, how, using that money, how many of these unlicensed facilities have you all been able to register?
First and foremost, thank you for the question. It's an excellent question. The way that the system currently works, mental health did, and now the Healthcare Facilities Commission are the entities that license facilities. And the way that the system works, they report to us when someone is operating without a license, and then we place them upon the registry. Currently, there is no one on that registry. That said, the permanent rules became effective just last December. So I think what we're doing is we're building for the future. Let me say what I'm saying by that. Right now, facilities with four, I think it's fewer than four, are not required to get a licensure. So there's a lot more group homes that are not required to have a licensure that actually wouldn't show up on the registry because they're not required to be licensed. If we ever do a holistic licensing program, I suspect that more folks will show up. Let me tell you what I'm talking about. We have a task force that the governor's office had assembled with us, DID, TennCare, mental health, and our AAAs, and a few other folks, where we look at some of these facilities when we get reports on someone who's being abused or neglected to figure out where we're going to place these people, how we're going to deal with this situation, working with APS. There's about 37 of those facilities that we have dealt with. But again, these particular facilities do not require licensure. Now, that said, I'll say this to you. I'm a big believer in taking risks and not being afraid to fail. So we have put this registry together, and we'll see how it goes going forward. And if we do licensure for smaller group homes, I think there'll be more on there. Logan Grant with the Healthcare Facilities Commission tells me there's a few folks in the pipeline. But I also don't think that the government needs to be incentivizing putting people on a registry for not having a license if they don't in fact require one. But if the General Assembly so should choose that they ought to be licensed, then I think we'll have a different scenario. But if this thing doesn't work and we come here next year after a year, then we'll probably need to do away with that, to be honest with you. But I'm optimistic that it's going to continue to work. But right now, it is very limited. I need to be very candid with you on that.
Okay, thank you for that information. Let me ask a follow-up question. Do you have any approximation of how many unlicensed and unregistered facilities there might be in Tennessee?
You know, there was a white paper that was created on that last year. I can't tell you off the top of my mind. We certainly can get that information back to you. I do have a listing of how many facilities are licensed across the state, but I can't tell you in particular how many are not licensed.
Sure, that makes sense. Well, thank you for that. Next on our list is Chairman Whitson.
Thank you, Chairman Bond. Good morning there, Director and team. Appreciate what y'all do. As a guy that was born at the peak of the baby boom, I'm very interested in your operation and what y'all do for all us old folks. Before I get to my question, just one comment. You know, there's a challenge, I call it the digital divide in this country. Is for us folks that are not born with the smartphones and the computers and stuff as we were growing up. And there's too much requirements on this phone now for us to access services and how to attend events. And I just want to make sure your agency takes a look at that and make sure that companies are accommodating the older population that may not have access or the knowledge of smartphones. That's a personal comment, okay? So my question is this. Last year, the legislature created a 3-year respite care program for caregivers of individuals with Alzheimer's and related dementia. The pilot program was funded with $1 million to provide grants to each of the 9 area agencies and actively served up to a total of 225 enrollees beginning on the 1st of July 2022. How many families have been enrolled so far, and has there been any obstacles or issues in starting up this program?
Thank you for that question. And also thank you for your work on that legislation, all that you do with Alzheimer's and dementia. And also thank you to Representative Ryan Williams. We certainly need to do more in this space. So that y'all know, and many of you do, and I apologize for being redundant, there's a state unit on aging in every state. It's required under the United States Older Americans Act. We have, I think, 40-something slotted employees, I think 31 currently filling those slots. Underneath of that apparatus is the AAAD system. 7 out of 9 are tied to economic development districts. They have boards of mayors. Y'all know how all this works. There's 500 and some employees under that. That's before you get to the provider network. Ordinarily, the way that money flows down through the United States government and through the state, it comes to the SUA, where the SUA then has oversight of the AAADs. And then we can set up area plans where we sort of drive performance. In this particular case, the bill, and I'm sorry because it kind of came across a little bit late, the way that it was set up, the funding that each of the 9 AAADs are to take that money directly and to provide a report to you all. So they have done that. Again, it is a pilot program. I think we can do a better job, and I look forward to working with our sponsors to tighten it up a little bit, because I think we can be a better driver for you in partnership with these AAADs. I do have the report that they have provided. And to your question, sir, it appears that 62 caregivers were enrolled and 54 folks received that care. The AAADs have raised some concerns just about flexibility in different things. We have a lot of people with Alzheimer's and dementia, frankly, who are not diagnosed, also that they can be very expensive to get done. And so they're looking for some more flexibility with that. We do other respite services for Alzheimer's and dementia, but more broadly, just across the spectrum. And it has been a little bit more successful. This legislation was tied a little tighter specifically to Alzheimer's and dementia. And I think we can make some tweaks that can make it really great. I'd like to work with these AAADs, work with y'all, and just tweak the legislation a little bit and try to drive a little bit more some of the performance and see if we can get some better results.
Yes, and I really want you to stay on top of this, because I know how important it was to Chairman Williams that we pass this because I mean that was a great bill that you passed last year on that, and and we need to help those folks who are the caregivers, because they are dealing with this issue just as much as the ones dealing with Alzheimer's too, and I know that firsthand. Thank you.
Chairman Williams, you're recognized.
Thank you, Chair Lady. I know my name was called inappropriately, but I actually want to do that. And Director Dunn, I really appreciate your kind words, but obviously this is something very personal to a lot of Tennesseans, Alzheimer's care, and there's still a lot of work left to be done, because based upon your comments about providers and who are actually participating, the problem is that's what is that? That's 1/5 of the number of families we hope to serve in the past year. And so there's a lot of meat left on the bone. I think we can make some improvements to the whole process. But my question is about options waiting list, and representative from Nashville's head's in the way. So in case we lose eye contact, it will be his fault. But we, in the 22-23 budget, $9.5 million reoccurring. We're trying to do a better job, as the graph up there shows. Even if we were able to improve what's happening this year, next year we're going to be adding more folks. And so as it relates to the waiting list, the idea was to try to get as many people off the waiting list as we could. Can you tell us how that went, or what the process looks like? Were we able to remove everyone off the waiting list, or if we haven't, what the remainder looks like?
So let me say first and foremost, to the point of the need for caretakers and the expansion on that, there's a lot of talk about increasing rates. We have increased rates twice. We very well may do it again. We do our rates tied to TennCare's rates. But I can tell you this, we will never be able to pay these people enough, in my humble opinion. There are a lot of advocates that could disagree with me on that. Let me explain to you a little bit more about what I'm talking about here. 2034, the United States expects that we're going to have more older people than younger folks. So if you look at the pyramid, the older people at the top is starting to do like this. The point being, we're just not going to have enough labor to be able to do what we need to do. So we're going to have to be more innovative. I got some ideas on that. But anyway, your question specifically on the options program, we have made some progress there. We are nowhere near where we need to be. We've brought, 1,300 folks off of the waiting list. So we've made a dent in it. But we continue to hear from our AAAD network, there is a deficiency in the number of staff available to serve these folks. That's why it's so important that we get self-directed care done soon. TennCare does this right now with choices. And what that means is you can bring somebody from church, a neighbor or someone, and pay them in lieu of a provider to be a caretaker for a person. And we can really compound our labor force that way. And I look forward to doing more on that. And I think we're going to have that going soon. We've got a contract on that with a company called Morning Sun, but the policy is being put together. We need to get that implemented, and we cannot move fast enough. So anyway, we've moved 1,300 people off of the waiting list. At the start of the fiscal year, there were 4,058 individuals on that waiting list. So there are currently 3,739. And if you're asking, that math don't add up, the reason why is because people keep getting put on the list even as we're taking people off. So that's where we are right now on that.
Thank you for that. And you're right. I mean, since I was able to look at the numbers, based upon the number you just gave me, it's increased by 47 people since just when I took the numbers down of how many were on the waiting list. I did have a question, though, based upon that. The reason why you didn't ask for more reoccurring revenue this year to get people off the waiting list, is that mainly because you like the idea of the TennCare solution as it relates that you just described, or did you just feel like the timing was inappropriate to ask for additional revenue?
Representative, as y'all believe, I'm a steward of taxpayer dollars, and I believe we need to be very responsible with those dollars. We have received a good portion of money in CARES funding, which we have spent 100% of. We still have ARP funding laying over. I have several AAADs who have not spent 100% of their money. I cannot in good faith ask for more money if they have not spent that money. And I firmly believe that if we're going to have money, we need to spend them on the services that are needed and not spend them wastefully. So I say all that with the caveat that, yes, sir, we still do not have the provider network to be able to serve in this capacity. That's why at some point of time, and I've been talking to the administration about it, I'm going to talk to y'all more about it. We have historically always treated options the same way as the Older Americans Act funding. Under the Older Americans Act, we must, through a formula, put money down through these AAADs, and then they have a certain level of autonomy. If we're ever truly going to serve this bunch with the capacity that's going to be needed, we're going to have to start looking at doing things from a statewide perspective. If I don't have to treat option state dollars the same way that we do OAA dollars. For example, when we have a provider who serves across multiple AAAD networks, I just had one the other day tell me they're leaving the network. Why? They said because we got different billing schemes from AAA to AAA. If we could do a statewide contract and I could use state dollars to do that, the AAADs may not like that, but it's a way to fill the void. And I think going forward, we're going to need more state autonomy. We're going to have to be innovative, and we're going to have to expand on the state's capacity to serve and not just rely entirely on the AAAD network. So we've got to do more work in that area. But I hope that answers your question, Chairman.
Chairman Faison.
Thank you, Madam Chair. Well, first of all, I'd just like to give a shout out. Before you took over, Dr. Dunn, it was rare for anybody in the whole outside of finance or GovOps to even have ever heard of the Commission of Aging. And sure never saw anybody from the state, Nashville, come to my county and present a check or be a part of anything that had to do with senior citizens until you took over. So I just want to give a shout out. And I'm sure there's plenty of other members who appreciate that because y'all were never heard of until the last couple of years. So thank you for that. Kudos to you and your team for doing that. So for the community living provides home for community-based services to the elderly and adults with disabilities. Last budget, they received 1.25 million recurring funding to increase the pay of direct support professionals and the options for community living program. This year, the government proposed budget includes another 300,000 increased pay. Here's the question. How much was the pay of direct support professionals increased? And have you seen any effect in the staff retention or turnover?
So I cannot speak to the retention or turnover. I can speak to the delivery of services. Those have increased. I would also say to you that, 10 Care on a per unit rate, what's the rate, Gail? $23.44 per unit hour for personal care homemaker. The way that 10 Care does is they says it's a flat rate. We're going to charge the same no matter what. If it's Obion County, Lake, to Mountain City, it's all the same. They also say that of that amount, you have to pay the caretaker $12.50. You have to. It's not really up to the provider. You have to. What we do in our shop with the OA dollars is we say to each AAAD, you negotiate with that provider up to this cap amount. And what they pay the caretaker is what they pay the caretaker. Because we fully realize, it's a lot different in Nashville compared to some of our rural areas. But this is tough business, y'all, but it's nothing new that of low skilled workers. I mean, we're down across the board. It's not just with us, it's across the board. So what I could tell you is that our services have gone up. I could tell you what I verbally hear, which is that our AAADs are regularly talking about, hey, this provider network is losing out. We can't pay people, et cetera. There's a lot of talk about that. I think there's some merit to that at a time where fast food is way up in different things on what people are paying by the hour. But I can't speak specifically, holistically across the state as to what our retention level is, because so much of that is unique to each provider network.
Chairman Faison.
Thank you, Chair Lady. And finally, so with the additional 300,000 appropriated this year, what's the rate? What will that bring the rate to? And obviously, you can't answer this because nothing's equal in this great big state from end to end. But is it sufficient?
Woo.
Yeah. Good luck with that.
So we have statutory authority to increase our rates at no more than 20% above the Medicaid rate. To me, and I've talked to Director Thurman about this in F&A, it doesn't make sense for state entities to be competing with one another and driving up rates artificially. We really should be all on the same plane. And so what happens when DID raises a rate, 10 Care does, vice versa. I'm just trying to hang with them. The point of inception for an assessment for an older person happens in the AAAD system. If it is determined that they may be eligible for Medicaid for home community-based services or long-term services support, then a medical evaluation takes place. But it all starts with the AAAD network. So the 300,000, we are certainly happy to have it. I think the governor and this General Assembly has done a great deal to put a lot of money in the pot. I mean, our base budget is 80-something thousand. Our budget overall really is 90-something $1,000. To put that 90 million, excuse me, to put that in comparison, I mean, that's double some of our smaller departments. So thank God y'all are doing what you're doing for the older people, and I'm trying to do all I can as well. Does that answer your question? Thank you, Chairman.
Representative Shaw.
Thank you, Madam Chair, and Commissioner, thank you for coming to our district. I am being redundant, as our last speaker said. Thank you for coming, making the check presentation. That meant a lot to those people, and more than you would ever know for you to do that. And then I want to personally thank you while you're here. This committee don't know that we had a talk at 9 o'clock on Saturday night, and you called me because there was a problem that needed to be fixed at one of our centers, and I really appreciate that. I just want to tell you publicly, you're doing a good job.
Thank you.
Thank you, sir.
That means so much to me. Thank you.
Chairman Zachary.
Thank you, Madam Chair, Director Dunn. Good to have you here this morning, my friend. Thank you for the work that you do, and thank you to your team. Just a quick question about the 9.5 million in ARP funds that you guys received. Just kind of overall, how much of that money has been spent? How many people have been serviced? Can you just kind of give us an overall breakdown of that?
Sure. Let me just say this as a preliminary. So when we spent the CARES Act funding, we used the ARP in the way that we do all the traditional funding under our categories under the OAA. So for nutrition, transportation, home community-based services, all the things that we do. And we used ARP in that way and set it up categorically. A lot of states were doing innovative things. We did a few different things, but we really try to keep that minimal so that we could use the ARP funding as we come off of the CARES Act funding to supplement it for a few years out so that we could have a soft landing if need be. And we may come back and ask for more money. But as far as the money that is spent out of ARP, Gail, can you help us with that?
If you would,
Microphone.
just identify
Thank you.
yourself and get your mic on there. Thanks.
Hi, I'm Gail Wilson. I'm the Director of Finance, and I don't have the exact amount that we've spent so far with me, but we can get that information to you.
Thank you.
Chairman
Thank you, Madam
Zachary.
Chair. If you would, please, yeah, because we would like to see the breakdown. And Director, can you just, as you're answering the question, without those funds, what would your office look like without those funds?
Without the ARP funds? That's a great question. It's something that we need to be looking at. Right now, we've been using it as a padding. We've been trying to drive the services. We are, again, our funding formula, I had UT do a funding study for us, and we may be adjusting our formula. I'd like to get to, at some point of time, pay for performance. With the OAA, I have to use a funding formula and distribute, but I'd like to be able to use options for when those AAADs are performing well, to be able to incentivize and give them more money to do even better. But without the ARP funds, I mean, I'd have to do dollars to services and do the math on that to figure out exactly. And to be candid with you, I don't have a specific figure as to what that would mean in services. We will get that answer for you.
Very good. Thank you. Thank you very much. Thank you, Madam Chair.
Representative Love.
Thank you, Madam Chair, and let me join those who are commending you for the work that you're doing and to specifically lift up the Alzheimer's Respite Care Program. Representative Shaw and I were just talking about the tremendous amount of financial burden that being a caregiver places upon those families, because insurance may cover the care for the patient, but there's normally not any funds provided for the one giving the care, for the family member. And so we know this is a major piece we must look at. We talk about providing care for family members who are the caregivers. So just want to commend you on that work, and hopefully we can extend this pilot program at some point beyond the 3 years and beyond the number of families that it does provide services for. So thank you for that.
Thank you, sir. We house the Alzheimer's Task Force as well, that Doc Kumar and Senator Rusty Crowe sit on. And on that task force is Alzheimer's Tennessee and the Alzheimer's Association. So we are constantly looking at ways to improve in this space, and they are very grateful for the work that y'all have done. We're going to tweak that law. We're going to make it even better. We're going to do even more. I want to put something in, if I may, just put something in context. So we serve 76,000 people in home community-based services. I just told y'all there's 1.7 million people that are 60 and older. In 10 years, when they're 70, in 15 years, when they're 75, think about that. This population and what we are going to have to do, there's an enormous amount of people, frankly, who don't have adequate savings. This is a multifaceted problem. It will require multifaceted solutions. And I'm talking about housing, transportation, medical, caretaking, a lot of different things. So we're really going to have to get innovative in the future. And really, to me, this is one of the most underestimated public policy issues of our time. So I'm so thankful that there's so many of you all are really paying attention to it and allowing me to come into the community and see what's going on in your community. It means a lot to me personally. It means a lot to me professionally. I look forward to working with you to solve these problems.
Representative Sparks.
Thank you, Chair Lady. Thank you, Commissioner. Commissioner, we just talked about Alzheimer's and dementia and some of those areas and being creative. You mentioned music therapy. Members may not realize that this week is Music Therapy Week, and I appreciate everyone co-sponsoring our HJR 96. I think you knew about my situation with my sister And I think I may have shared it, but there's got to be something with this music therapy. I'm telling you, there's something there. There'll be music therapists on the floor today. They may come by your office. They do work with dementia patients and Alzheimer's patients, Parkinson's, and it's been proven as a benefit to those patients. My sister, strangely enough, about 4 years ago, was trying to leave the nursing home in her wheelchair. Sadly, she can't walk from a brain injury, and she was singing the song "Country Road, Take Me Home, the Place I Belong." It just shocked me, and then I walked up to her and tapped her on the shoulder, and she asked me, "You know how to get out of this place?" It was a little humorous, but she did not know my name. My mother recently passed in December. I was playing Amazing Grace on my iPad, and we passed that bill 2 years ago, making an official state song. And she was from Scotland, so she's used to the bagpipes. And I watched her; it was almost a case study. And I watched her breathing, her moans calm down, her breathing calm down, and then she passed the next morning. But there's got to be something with this music therapy. I don't know how much of a budget increase it'll be. I know some of that's what funded from the arts, I guess. And but I just want to thank you and what you're doing to try to be creative and innovative with some of these solutions. And thank you to your staff as well.
Thank you.
All right, Director Dunn, I don't have any more questioners on my list, so let me add my thanks to those that have gone before. You've been in my district, and I think that the work that is being done by your organization in getting money out across the state has been an improvement on some of the processes that went before, and I hope that we can continue to modify that and tweak that and continue to make sure that we're helping all organizations. 'Cause so many of our senior citizens centers, particularly across the state, they don't have the staffing to apply for grants. And, some are very well staffed in our urban areas. Some in our rural areas just operate on the literal shoestring. So we appreciate the fact of trying to give more of these organizations an opportunity to get the help that'll just push them over the edge and keep their doors open, frankly, because some of them, they're very close to not being able to do that. So we appreciate that work along with everything else that you're doing, as some of us on this panel are already in the elderly category. Everybody will get there, God get willing. So working with the aging and the disabled is something that is should be of a personal interest to everybody. But thank you for your work. Members, that concludes our budget hearings for today. We are now back in session. And Chairman Hicks had to leave the room, but he asked me to announce that his Finance Subcommittee will be meeting at 10:30 in House Hearing Room 3. So those of you who serve there, you have a 15-minute break. Use it wisely. We are adjourned.
Check 1, 2, mic check. Check 1, 2, mic check, check 1, 2.